The silent health crisis killing men over 60. What I'm about to reveal could save your life or the life of someone you care about. Right now, as you're watching this, thousands of men over 60 are making a decision they believe is virtuous, mature, even respectable. But this choice is silently destroying their health, crushing their vitality, and accelerating their decline toward an early grave. The tragedy? Most have no idea they're slowly killing themselves. Before I continue, if this resonates with you, if you're tired of feeling like your best years are behind you, hit that subscribe button and ring the notification bell. This channel is dedicated to giving mature men the truth about health that nobody else will discuss. And if you find value in what I'm sharing today, please give this video a thumbs up and share it with any man who needs to hear this message. Your engagement helps us reach more men who desperately need this information. The coroner's report was brief, clinical, final. Natural causes, it stated. No trauma, no struggle, just the quiet surrender of a 67-year-old man found motionless in his favorite chair, television still flickering in the darkness. But those of us who understand the warning signs recognize something far more insidious. The gradual collapse of masculine vitality, not from disease, but from a well-intentioned decision that slowly poisoned his system from within. His story isn't unique. Every single year, countless older men experience the same devastating decline: diminished strength, vanishing sexual function, emotional emptiness, all while believing they're making the mature, responsible choice by abandoning what society taught them was juvenile and unnecessary. For generations, we've convinced men that self-pleasure is shameful, immature, something to outgrow. But after 60, this mindset becomes a silent executioner, systematically dismantling everything that makes you feel alive, confident, and whole. The truth they won't tell you? When you completely abandon masturbation in your later years, your body doesn't simply pause, it begins a relentless march toward deterioration. I'm Dr. Marcus, a board-certified urologist and men's health advocate with over 4 decades of experience helping aging men reclaim their strength, confidence, and zest for life. I've counseled farmers, military veterans, educators, and grandfathers, men from every walk of life who believed they were doing the honorable thing by abstaining, only to discover too late that their noble intentions were quietly sabotaging their health. If you're still watching, drop a comment below. Type 1 if you're ready to hear the hard truth, or 0 if you're skeptical. I welcome both responses because this conversation is long overdue. In this video, I'm going to expose the 4 devastating health consequences that unfold when you completely stop masturbating after 60. More importantly, I'll show you how to prevent this decline before it becomes irreversible. These are practical, medically sound strategies that thousands of my patients have used to protect their sexual health, restore their energy, and avoid the complications most men mistakenly accept as just getting older. Stay with me until the end because the final consequence I'll reveal is the one most physicians refuse to discuss. Yet it's the same factor that could quietly triple your risk of serious prostate complications if ignored. The first devastating consequence: complete loss of sexual function. The scene plays out in my office more frequently than I care to count. A man in his late 60s or early 70s sits across from my desk, confusion and frustration etched into his weathered face. His voice cracks slightly as he explains that he hasn't experienced a spontaneous erection in months, sometimes over a year. What disturbs him most isn't the performance issue itself, but how suddenly everything seemed to shut down. One day he felt normal, the next day something fundamental had died inside him. This catches most men completely off guard because nobody ever warned them that abandoning sexual activity could cause their sexual function to atrophy like an abandoned muscle. Let me be absolutely clear. Your penis is not decorative. It's a sophisticated organ that demands regular circulation to maintain its health and function. When you go extended periods without any stimulation, particularly after age 60, something catastrophic begins occurring.
Blood flow decreases, oxygen delivery drops, and the tissues begin to harden. Not in the way you want, but in a way that leads to scarring, nerve deterioration, and permanent loss of erectile capability. This isn't speculation, it's fundamental vascular biology. Consider this analogy. If you suddenly stopped using your legs for 6 months, what would happen? You'd lose muscle coordination, flexibility, and potentially forget how to walk properly. The exact same principle applies to your penis after a certain age. It doesn't simply go dormant, it begins systematically shutting down when neglected. The most sinister aspect of this decline is its silence. There's no dramatic announcement, no clear warning signals. You don't notice until it's too late. First, your morning erections vanish. Then, physical stimulation or fantasy fails to produce results. Eventually, even with pharmaceutical intervention, your body stops responding because the foundation has already crumbled. I've witnessed grown men break down in my office, tears streaming down their faces, asking if they can recover what they've lost. Some succeed with aggressive therapy, lifestyle modifications, and medical support, but others waited too long. They believed quitting masturbation demonstrated self-control and maturity, never realizing it was the quiet beginning of functional decay. This isn't about sexual obsession. It's about protecting a critical component of your circulatory system, hormone regulation, and masculine identity. Maintaining occasional solo activity, even once or twice weekly, keeps blood flowing, preserves nerve function, and signals your body that this capacity still matters. The harsh reality? What you don't use, you lose. And at your age, that loss can be permanent. I've watched this devastate men not because they're trying to impress anyone, but because it impacts their self-worth, their relationships, their fundamental sense of being a man. The tragedy? It was completely preventable, requiring not indulgence, but simple, consistent attention.
The second consequence? Hormonal collapse. While most men fear losing their erections, they don't realize that's merely the beginning. The next consequence strikes something even more fundamental: your hormones. Once they begin crashing, the ripple effects extend far beyond the bedroom. It usually begins subtly. A man stops feeling like himself but can't articulate why. He's less enthusiastic about getting out of bed each morning. He skips his daily walks. His appetite changes. His mood flattens. He feels more exhausted during the day, more irritable, more withdrawn. Deep down, he senses something vital is slipping away, but he can't identify what. In my practice, I've seen men attribute this to normal aging, stress, or poor sleep. But when we investigate deeper, we consistently find the same underlying cause. Their testosterone has plummeted, not just naturally with age, but accelerated by the complete absence of sexual stimulation. Here's what most people never learn. Masturbation is one of the few non-pharmaceutical methods older men can use to stimulate natural testosterone production. This isn't about sex or fantasy, it's pure biology. When you engage in regular arousal and release, your brain transmits signals that help regulate your hormonal rhythm. Dopamine levels rise, the hypothalamus activates, and your testicles, even in your 60s or 70s, receive the message to continue producing testosterone. But when you completely stop this process, when you go weeks or months without any sexual activity, your body receives the opposite message. It assumes intimacy is no longer necessary, so it scales back hormone production. Once this cycle begins, it becomes increasingly difficult to reverse. Men with low testosterone don't simply feel tired, they begin losing their identity. They can't concentrate. They lose interest in activities that once brought them pride. Their muscles begin weakening. Their bones become more fragile. They become more susceptible to depression. And perhaps most dangerously, their cardiovascular risk increases dramatically, placing them in greater danger of heart attacks and strokes. I've watched once vibrant men become shadows of themselves within just a few years, not because they were ill, but because nobody ever explained how crucial healthy, regular sexual stimulation is for maintaining hormonal balance.
One patient, a retired firefighter, told me that after his hormone levels crashed, he began feeling like he didn't matter anymore. His exact words still haunt me. "Doc, I don't even recognize the man in the mirror." The look in his eyes wasn't vanity, it was grief. This didn't have to happen. With proper education and a simple habit he thought was wrong, he could have preserved not just his hormones, but his happiness, energy, and drive. The brutal truth, once your testosterone crashes in old age, it can take years of therapy and thousands of dollars to restore it, if it comes back at all. But with steady, respectful engagement in your own intimacy, you can maintain the line longer than most people believe possible.
The third consequence: prostate congestion and pain. While hormones often remain invisible, the next consequence manifests as something every man feels in a much more physical, sometimes painful way. A condition that builds quietly within the body until it starts interfering with daily life. Most don't even realize it's connected to something they're no longer doing. There's a type of discomfort older men rarely discuss. A heavy, dull ache deep in the pelvis, strange pressure after sitting too long, or the persistent urge to urinate even when the bladder isn't full. It doesn't strike suddenly like a heart attack. It builds slowly, quietly, until it starts disrupting your daily existence. By the time most men mention it to their physician, they've already been suffering for months, sometimes years. What's shocking is how frequently this silent suffering can be traced to one overlooked cause: prostate congestion caused by lack of ejaculation. Your prostate isn't merely a bystander in the male body. It's an active gland that produces and stores seminal fluid. That fluid is designed to move, to be flushed regularly. When you completely stop masturbating or having sex, especially in your later years, that fluid stagnates. When it stagnates, it thickens, pressure builds, inflammation creeps in. That's when you start noticing changes: slower urine flow, discomfort in your lower back, that constant urge that wakes you multiple times each night. As a urologist, I can't count how many older patients arrive thinking they have a bladder problem, only to discover they're dealing with an irritated, inflamed prostate. In many cases, the solution isn't medication, it's movement. It's the body's natural cleansing process through regular ejaculation. When this process is ignored for too long, the consequences can be severe. Some men develop chronic prostatitis, a painful, long-term inflammation that's difficult to treat and even harder to live with. Others require invasive procedures just to feel normal again. Beyond the physical discomfort, there's another layer of danger most men never hear about. Research, including a well-documented Harvard study, has demonstrated that regular ejaculation may help reduce prostate cancer risk. The theory is straightforward. When the prostate is regularly emptied, it reduces the accumulation of potentially harmful substances. But when that fluid is allowed to stagnate for months, it may increase inflammation and long-term risk. I treated one man who had gone almost 2 years without any sexual activity. He didn't feel the need, he told me, thought it was behind him. But when his PSA levels spiked and we conducted additional tests, we discovered significant congestion. His prostate was swollen and irritated, and he was facing biopsy discussions that could have been avoided with something as simple and natural as maintaining occasional release. This isn't about encouraging lust or indulgence, it's about preventing suffering. It's about understanding that the male body doesn't suddenly stop needing care after 60. If anything, it requires more attention, more respect. The fourth and most devastating consequence: emotional and mental decline. While a congested prostate might cause pain, irritation, and sleepless nights, the final consequence strikes deeper. It attacks the core of how a man feels about himself, and for many, it's the one they never see coming until it's already taken hold. It's the quietest decline of all, and often the most devastating. It doesn't appear on blood tests. It's not something you can easily measure, but you feel it profoundly. A slow fading of the spark you once possessed, a creeping sense of disconnection, a distance from yourself that you can't quite explain.
It happens gradually. You stop masturbating because you believe you don't need to anymore. You tell yourself it's age, lack of interest, or simply how life works when you're not in a relationship. But over time, that decision doesn't just affect your body. It reaches into your mind, your emotions, your very sense of being alive. I've spoken with men who describe feeling hollow inside, not because of disease or pain, but because they've gone months, sometimes years, without any form of release, without any intimacy, even with themselves. Gradually, they begin feeling invisible, unwanted, unnecessary.
They don't discuss it, of course. Most older men were never taught how. But it shows in their posture, in how they avoid mirrors, in how their voices grow quieter when asked how they're doing. This isn't about sex. This is about vitality, about the subtle but powerful connection between your physical body and emotional well-being. When you completely abandon self-pleasure, you sever one of the last remaining pathways to joy, to self-recognition, to feeling human. For men over 60, that's not just a loss, that's a wound. Because arousal, pleasure, and release aren't exclusive to youth. They're part of what keeps your brain engaged, your hormones balanced, your emotions healthy. Neurologically, the chemicals released during masturbation, dopamine, oxytocin, endorphins, are essential for regulating mood, reducing anxiety, and reinforcing emotional stability. Without them, men are more likely to experience depression, loneliness, and even cognitive decline. I've watched men who were once confident and sociable slowly become isolated, withdrawn, and apathetic, not because their lives changed drastically, but because they stopped connecting with a part of themselves that once made them feel alive. Here's what makes this so dangerous. Many men don't realize this connection exists. They never link the emotional numbness to the decision they made months ago to stop engaging in intimacy. By the time they feel the effects, the damage has already begun. Reversing it requires more than hormone therapy or a new routine. It takes rebuilding the relationship with yourself, remembering that even in old age, your body still longs to feel, to express, to connect. This is the consequence that breaks my heart most, because it's the one that steals a man's dignity without him realizing it. It takes away the quiet confidence he used to carry, the warmth he used to offer, and leaves behind a shell he no longer recognizes. Reclaiming your vitality. There's a belief many older men carry, that intimacy, pleasure, and desire are things you outgrow, that after a certain age, your body is supposed to go quiet, that it's noble, maybe even respectable, to surrender that part of yourself. But after more than 3 decades as a physician working with men in their 60s, 70s, and beyond, I can tell you that belief is costing far too many men their health, happiness, and identity. You've heard today how completely stopping masturbation can lead to the gradual breakdown of your sexual function, a dangerous drop in your hormones, the swelling and inflammation of your prostate, and a silent emotional numbness that erodes your spirit day by day. These aren't minor changes. These are life-altering shifts that happen not because of aging, but because of neglect. But here's the good news. It doesn't have to be this way. Your body still remembers how to feel. Your mind still longs for connection. Your health still depends on you honoring every part of yourself, even the parts no one else sees. This isn't about lust. It's about life. It's about preserving what makes you feel strong, whole, and human. You don't need to feel ashamed for choosing health over silence. If this message resonated with you, I want you to take action right now. 1. Hit that subscribe button and turn on notifications so you never miss content that could transform your health. 2. Give this video a thumbs up if it opened your eyes to something important. 3. Share this with any man who needs to hear it. You might save someone's life. 4. Comment below with a 1 if you're ready to take control of your health, or 0 if you need more convincing. Your engagement helps us reach more men who desperately need this information.
If you're ready to take back control of this part of your life, I'm with you. You're not alone, and you're not done yet. Remember, it's never too late to come back to yourself. Never too late to reawaken the energy you thought was gone. Your best years don't have to be behind you. They can still be ahead. Your voice matters, your health matters, and you're not alone in this journey.